Hi, my name is Dr. Curtis Anderson, and I am Medical Director of Florida Endovascular and Interventional in South Florida. I'm going to talk to you today about a common condition that affects men called BPH, or benign prostatic hyperplasia, and a new non-surgical treatment for symptoms of an enlarged prostate called prostate artery embolization. The prostate is a small organ which sits at the base of the bladder and normally is about the size of a walnut. The prostate wraps around the urethra, the tube that drains from the bladder. The urethra is the tube that brings urine through the penis when you urinate. In most men over the age of 40, the prostate begins to enlarge over time, and in some men can start to press and squeeze the urethra, making it more difficult to urinate. By the time men reach the age of 70, nearly all men have an enlarged prostate. The increased size of the prostate is called benign prostatic hyperplasia, or BPH. As the name states, this process is benign and is not related to prostate cancer, which is a different process altogether. When the prostate enlarges and squeezes the urethra, it can cause a whole host of different symptoms, including a weak urine stream, the feeling of not emptying the bladder, urgent need for urination, and frequent urination at night. These symptoms can be disruptive to your life and make it difficult to do the activities that you enjoy. If you are having urinary symptoms because of an enlarged prostate, it is important to get evaluated by a physician. The first treatment for BPH is medications that try to prevent the growth of the prostate or decrease the pressure of the prostate on the urethra. These medications have been used for many years and should always be considered the first line of therapy. For the patients who do not find relief with medical therapy alone or cannot tolerate medical therapy, there are both surgical and minimally invasive therapies available. Most of the surgical therapies are offered by urologists and involve using various techniques to debulk the prostate by inserting devices through the tip of the penis to either cut out, burn, or otherwise remove or reduce the amount of tissue in the prostate. These therapies can be quite effective in removing prostatic tissue and relieving symptoms of BPH, but come with risks of bleeding, incontinence, and impotence with varying frequency depending on which device or technique is used. The procedure that I would like to introduce is relatively new and is performed by interventional radiologists like myself. Prostate artery embolization, or PAE, involves inserting a small catheter about the size of a spaghetti noodle into the artery in the left wrist, or in some cases the artery in front of the hip, and navigating that catheter into the arteries in the pelvis that supply the prostate. To do this, your doctor uses x-rays to track the movements of the catheter as it is steered to the vessels in the pelvis. Once the correct artery is identified and catheterized, small permanent beads are injected into the artery to clog up the blood flow. This is performed on the arteries to the left and right halves of the prostate until little to no flow is seen going to the prostate. The result of this procedure is that the prostate begins to shrink over a period of a few weeks. Typically, by 3 weeks post-procedure, patients feel a significant improvement in the urinary function. The prostate then continues to shrink over a period of 3 to 6 months. Most patients experience only mild discomfort in the post-procedure period for up to a week. The procedure is performed under light sedation as an outpatient in one of our outpatient office-based procedure centers, and you go home the same day. There have been no reported cases of sexual dysfunction after this procedure. If you are experiencing symptoms of an enlarged prostate and would like to learn more about this minimally invasive outpatient procedure, visit our website at www.flinterventional.com or call our office at 786-534-2555. We have offices in Aventura, Miami Lakes, and Plantation. Thank you.